There is a health crisis here, but it may not be visible. And it's here too, invisible, but a fact. 1 out of 50 Americans have no access whatsoever to a doctor, none at all. For others, the distance to the nearest doctor is very great or difficult. For still others, because physicians have such heavy caseloads and for other reasons, getting medical attention is often a discouraging process. There is an alternative to this healthcare crisis, bridging the gap, providing care for the patient and assistance to the physician, the paraphysician. MEDEX, the program and the person, an alternative designed to extend the physician's capacity. MX is the abbreviation for MEDEX. It appears on the window of the doctor's office in Othello, Washington. Behind the sign is an example of medical progress. Paul Snyder is a new image in medical care, one of the first totally new health professionals in primary care in this century, representing 3.5 years of research and development. MEDEX Snyder is a paraphysician, another pair of skilled hands under the direction, supervision, and control of the physician. As a word, MEDEX is a contraction of the French, meaning an extension of the physician. What it means to the physician, only he can tell. This is Dr. Kenneth Pershel.
The MEDEX program has done several things for us. We had a very busy practice, and our practice, as a matter of fact, is more busy today than it was previously. It has enabled either Dr. Bunch or I to be home in the evenings, where previously we were not, simply because of our surgery schedule, which we do in the evening. The second thing that has markedly helped us is the emergency room coverage in the hospital. We use these gentlemen to do our emergency room coverage basically, and then one of us back them up. The other facet that has been of real importance to us is the office load. Our office load certainly has increased. Many patients call in and want appointments to see the medics primarily, and we give them appointments to see them. It cuts down the number of patients that Dr. Bunch and I formerly was seeing, and we not only can spend more time with the patients, but I'm sure do a better job in the practice of medicine. And the patients themselves are happy because they don't have as long a waiting period in the office. They can come in for the minor things that they feel is minor and frequently are minor. They're able to be seen and are on their way, and this is of economic importance to the patient because time is a valuable commodity to them also.
Doctors like to congregate, and they usually congregate in places where there are other doctors. This distribution tendency is one of the most critical elements in our health manpower shortage. But this particular gathering of physicians, drawn from urban, suburban, and rural settings, is the first step in the MEDEX program. Early participation by the physician in the MEDEX program permits the MEDEX staff to incorporate into training the skills needed by a MEDEX, necessary for the physician's practice. By gearing the training then towards competency in the performance of identified tasks, MEDEX training is practical and does not waste time and money with unnecessary training unrelated to the job.
The MEDEX during this 12-month preceptorship.
I think perhaps maybe I'll have more time than the average physician.
When a need has been determined for an area, the next step is a needs assessment where a MEDEX staff member visits the physician to determine if he would like to increase his coverage and improve the quality as well as the quantity of the health care he provides to his patients.
Office, and I've certainly discussed the prospect of a MEDEX.
The source of manpower for MEDEX to date has been former military-trained medical corpsmen who have had independent duty or have been qualified for independent duty. These are experienced and advanced corpsmen who have been providing medical care in locations where their judgment and decision-making abilities have been tested thoroughly. The independent duty trained medical corpsmen often have had more than 800 to 2,000 hours of formal medical training and experience in isolated areas such as submarines, radar stations, and missile sites, a valuable manpower pool. Inquiries are received daily at the Communications Center located in Seattle. Applications are mailed back with information on the MEDEX program. A preliminary screening takes place upon receipt of this formal application. Those applicants who meet the preliminary criteria of the medical schools presently training medics and the medical schools which are planning to train them are inserted into the computer.
Yeah, that's why I'm here, because we've got these graduates out now. The center did a good job for us in getting that first...
Here, Dr. Gerald Bassett describes his needs in the Rocky Mountain area, where he's the director of the MEDEX program at the Medical School of the University of North Dakota.
The information. I want the right kind of guy, just like we had this first time. We have, you know, a blend of Army, Navy, Air Force, Special Forces.
The medical schools utilize the Communications Center for further screening of specific requirements. Selections are made from the printouts by the medical schools to meet their requirements, and copies of the original file are forwarded to the schools for final screening. A major difference between the MEDEX program and similar health manpower programs is in the individual needs assessment methodology. Once the needs of a specific physician have been assessed, the search is underway for competencies to match those needs. The independent duty corpsman often can match many of the task needs. During the training, these competencies enlarge to meet the physician's requirements. But it is only during the year-long preceptorship under a physician, which follows the university phase, when the matching of competency with need truly occurs. The initial stage of the MEDEX process is an interview selection conference where applicants are brought in for testing and interviews. Interviews are set up to determine which applicants are most appropriate to work in the communities needing help. The major responsibility for selection rests upon the shoulders of physicians who need MEDEX, and this conference views the applicants with the physicians.
Oh, we had typhoids and some surgical problems.
The initial meeting is a direct result of the careful screening by the university faculty, MEDEX, and State Medical Association staff members of applicants to the program in an effort to appropriately fit competency to need.
John, I'd like to have you meet my receptionist.
Following the meeting, applicants visit physicians in their practice settings. This permits the physician and the potential medics an opportunity to become acquainted with each other in a more relaxed situation.
Good morning, John. I'm coming to my office here.
This afternoon we're going to talk about the problems of abdominal pain, the question of the acute abdomen, and the patient who comes in perhaps in the middle
Once
of
the careful selection process has been completed and trainees selected, training gets underway in the university phase. The curriculum of MEDEX is competency-based training. Task analyses performed in the offices of physicians has determined what tasks medics should be able to perform when they finish their training 15 months later. Emphasis is placed on pediatrics, geriatrics, and chronic diseases, areas in which the physicians feel that medics need more training. In addition, emphasis is placed on psychiatry, history-taking, physical examinations, and some physical diagnosis using newer training techniques and building on the previous competencies the medics have gained in the military. Contrasted with other methods of training, competency-based training is pragmatic in its origins and objectives. Debriefing sessions allow student medics to share with the staff and fellow students experiences in learning and not learning, all of which leads to improved and appropriate training. Role-playing is one of the approaches used to acquaint the medics with the interpersonal relationships which exist in the practice setting, as well as in the medical school setting.
Is there more on one side than on another side? No. Okay. I'm going to turn off the light, Warren, and we're going to take a look at your sinuses here. Okay. What I'd like you to do is just close your lips right on the light.
Part of the 3 months training at the medical school is spent in clinical training. Here we see building of the image of this totally new professional.
Okay, if you tilt your head back for me and say big ah, ah,
Sounds like a pretty normal load for a Saturday morning.
The distinct identity is furthered by the blue coats that medics wear, so that they are not confused either in the medical school setting or out in practice with physicians who usually wear white. In addition, the word MEDEX, like doctor, is a form of address as well as a title. The initial MEDEX demonstration program was developed in the Pacific Northwest at the University of Washington School of Medicine. It was a collaborative effort of practicing physicians in the area, the State Medical Association, and the University of Washington School of Medicine. This prototype cooperative model involving physicians, organized medicine, and a medical school, plus other elements we've already discussed, have been used to develop MEDEX programs in other states, such as the MEDEX program at the University of North Dakota Medical School for medics in North Dakota, South Dakota, Minnesota, and Wisconsin. Another MEDEX program has been started at the Dartmouth Medical School in Hanover, New Hampshire for medics in Maine, Vermont, New Hampshire, Massachusetts, Rhode Island, and Connecticut. The University of Alabama now has medics in practice in Alabama, Georgia, Tennessee, and South Carolina. The University of Utah has deployed its first medics into preceptorships throughout the state of Utah and will soon have medics in addition in the states of Colorado, Wyoming, Nevada, and Arizona. The Charles R. Drew Postgraduate Medical School in Los Angeles, in conjunction with UCLA, is training medics for metropolitan areas in Southern California. The MEDEX program at the University of Washington has now deployed medics into the states of Alaska and Idaho and are making plans to work with other MEDEX programs in assisting overworked doctors in the state of Montana. At present, there are more than 200 medics working in 27 states. 4 more medical schools are planning MEDEX programs, and it's anticipated that soon there will be at least 10 medical schools training medics for 30 to 40 states. One of the basic elements in establishing MEDEX is the development of the receptive framework for this new professional. In the states where medics work, the legal barriers have been hurdled by either obtaining amendments to the Medical Practice Act or interpretation of existing laws favorable to the employment of new kinds of health professionals, such as medics. Necessary also in this development of the receptive framework for medics is the availability of malpractice coverage, which has been obtained without difficulty based upon merely 3 years of experience with this new professional. There have been essentially no problems as far as third-party carriers have been concerned, in that the MEDEX is a salaried employee of the physician, as are other personnel working with him. Therefore, the MEDEX is not in a fee-for-service relationship at any time.
They're convinced that they've got one problem, and that isn't their problem at all.
Another facet of the receptive framework development is the preparation of the community for this new professional. And of course, the physician is the best one to prepare his community. However, it's recognized that this facet of development of the receptive framework is extremely critical in taking a significant step to improve the delivery of care to patients.
How far he can go.
Why don't you go take a look at her ears and her throat and listen to her chest while I go over some of these others, and then come back.
After the 3 months of university training, the new paraphysician enters a preceptorship for a year of training with a physician.
Good morning, Peggy.
Good morning.
How you feel?
Pretty good.
Oh, okay, good. Have you been drinking a lot of fluids?
Yeah.
You've been coughing in?
Not very.
Here, the MEDEX trainee performs within the skills area delineated by the physician, who continues the MEDEX's training, developing competencies to the level of the physician's requirements. The MEDEX is taught how to perform many routine tasks which the physician usually performs, but which don't require the sophisticated training and experience of a doctor. The physician works extremely close to the MEDEX during the first part of the preceptorship, being sure that he's satisfied that the MEDEX works within his limitations and getting the MEDEX used to the uniqueness of his particular practice. The learning process continues throughout the preceptorship, with continuing education conducted by the MEDEX staff and the State Medical Association. This one-to-one relationship during preceptorship is the beginning of relationships which appear to be permanent in most instances.
You can call the lab and find out what that CDC is.
Although not always visible, the crisis in the provision of medical care in urban and suburban locales exists. This is Kent, Washington, a part of metropolitan Seattle. Here, MEDEX Charles Spurgeon starts his day. First, there is scheduled surgery on one of his preceptor's patients. Here he assists Dr. Miles Jones, the surgeon.
About 10 months ago, Bill Shaw came over and asked if I'd be willing to let MEDEX Spurgeon scrub on a few cases. I told him that my experience in the public health service, particularly up in Alaska, was very favorable. We used the medics both in the Air Force and in the public health service to great advantage. And these fellows were a valuable asset to us, and I told him I'd be very willing to have Chuck come over and scrub with us. Chuck has been in on a number of cases now since he came to work with Dr. Shaw, and each time he's been able to scrub with us, it's been a real benefit to expediting the case. I think that the great advantage of the medics scrubbing with us is that this relieves the general practitioner from always having to be at the table and leaving his practice, which many times is very hard for him to do.
Good morning.
Part of his day finds MEDEX Spurgeon visiting a Kent nursing home. He and other medics like him are helping physicians increase dramatically the coverage of nursing home patients.
Good morning, Ms. Richardson. Good morning.
Good morning, Mrs. Richardson.
Good morning.
Dr. Shaw asked me to come down and check your ankles. He understands that they're swollen up a little bit.
Well, they're better than they were, though.
Oh, good.
Much better than they were.
Mm-hmm. How long's this been going on now?
Well, it's been going on for about 6 months.
After completing his rounds at the hospital and nursing home, MEDEX Spurgeon returns to Dr. Shaw's office to continue his busy schedule.
Well, Mrs. Bell, I've finished examining Shannon, and there's a little bit more here, I think, that I can really handle being Dr. Shaw's out of the office.
I brought my little girl to the doctor because she was very ill and vomiting, and the doctor wasn't in that day because it was his day off. So the nurse asked me to wait and see the medics. So I brought her into the examining room, and he checked her, and I could tell that he was very worried as to it might be a serious illness. So he asked me to take her to a pediatrician that he had called, and which I did, and they decided that it was spinal meningitis. And I'm so thankful to the medics for finding this, because I know that it could have been so much worse if we'd have waited just a day or so longer.
She's finished with the card.
Oh, fine. Well, Mr. Woodworth, I'm MEDEX Spurgeon. I do part of the physical, and then Dr. Shaw will come in and finish the rest of it. I see you finished the scanner cards.
Well, I think the MEDEX program is a twofold advantage to me as a patient, and then in the course of my business also. The patient part of the thing is that when the MEDEX has finished his examination of me, why, I always have a consultation then with Dr. Shaw. We discuss any findings that he may have, so that frankly, I have complete assurance that I'm getting the kind of medical treatment that I want. First, of course, I have confidence in Dr. Shaw. He has confidence in the MEDEX Spurgeon, and so I really have no worries.
I feel that MEDEX Spurgeon has been accepted by the patients, and in that he has relieved Dr. Shaw of much work, it's like having an extra pair of hands for the doctor. At times when we are very busy, MEDEX Spurgeon helps me with blood work and x-rays, and I feel that he is very competent.
It's been a busy day. Chuck, did you have a chance to stop by Green River Terrace and see Miss Richardson this morning?
Yes, her ankles are down quite a bit from the last time when I checked them.
About 18 months ago, I became involved in the MEDEX program at the University of Washington. As a result of this, some 10 months ago, MEDEX Chuck Spurgeon came to work for me as a preceptee. Since that time, my practice has changed rather dramatically. The most striking change is that I feel I'm now offering a better quality of medical care to the patients that we're seeing. The reason for this is that prior to the arrival of Chuck in the office, I often was simply running from room to room as fast as I could, doing what I could for the more or less emergent situation, and not having time to deal with the more lengthy or more serious problems. My solution then was to put those problems off, to ask the patients to return at some other time when I hoped I would have more time. Now, with Chuck working side by side, when a serious problem arises, I feel no hesitation to sit down and go into it right at that time. The result of this has been that although the office now sees about a third more patients than we did a year ago on any one day, I personally spend more time with fewer patients. I see the sick patients. My practice has become more interesting. It's become more stimulating, and it certainly has become more rewarding. I fully intend to hire Chuck as a full-time employee as a MEDEX when his preceptorship is up, and I certainly would encourage any general practitioner in the state who wants to improve both the quality and quantity of care given in his office to investigate the MEDEX program.
The medical care crisis is often felt more acutely in rural communities. In White Salmon, Washington, Dr. Wayne Hinkle has been in practice for 27 years. A few years ago, he was planning to leave his practice, but now his capacity to provide care has been enhanced by MEDEX Ed Bivens. Bivens, who speaks both English and Spanish, has had 20 years of experience in the Air Force delivering primary care under physician's supervision in such isolated settings as Alaska, Spain, and Montana.
Well, that looks all right. You got to watch this epiphysis here, but there's no fracture in there. Just mainly where he's hurting, I think. That left is not too bad. He doesn't need spin if it is, but put spin on it.
Well, Ralph just looked at his x-rays. I can't see any fracture at all in his joints at all. But he does have a jammed finger from hitting a little bit.
As far as the specific duties that my MEDEX uses, and what I was really looking for were, first, a mature individual that had much experience in the type of medicine we see here in rural White Salmon. He needed to have experience treating minor injuries such as lacerations, minor fractures, contusions, abrasions. He needed to have experience seeing infants, adults with minor upper respiratory infection. He needed to have experience in general physical examinations to rule out major illnesses and disease. These were the things I looked for when I originally entered the program.
Well, Tom, the x-ray showed some pretty good healing in there, but you're still going to have to put the cast back on 4 weeks or so. 4 weeks? Mm-hmm. You can check it again in 4 weeks. And
it's a great pleasure for me to tell you about our MEDEX. I feel we have one of the greatest that we could ask for, in personality and ability both. I'm sure that we would have a real hard struggle in this little office and clinic without him. Dr. Hinkle just finished a 2-week vacation, one of the best and nicest ones he's ever had in the 25 years I have been with him. He came back very happy and cheerful. All the time he was gone, his office ran along just the same and as efficient as if he was here. And we have to give our MEDEX credit for his great assistance to us girls.
MEDEX Bevins, since he has been in this community, I think has done a lot for the people, and I know for myself that he has done a lot for me. It seems like I'm always getting bunged up, and he's always the guy there to help out and to make sure that everything turns out all right. And I sure have a lot of faith in him, and I think a lot of people in the community do also.
Okay, Mary Kay, just finished and can't find anything wrong with you, so I'll go ahead and finish out your paperwork.
It has also freed much more of my time in participating in the high school athletic physical programs. We have 5 schools around here who participate in competitive athletics beginning in the junior high level, both boys and girls. These require periodic physical examinations, and prior to Ed's coming, I spent much time performing these examinations.
The MEDEX program has worked real well here for the Skyline Hospital and the White Salmon community. MEDEX Bevins, our local MEDEX here, has been real well accepted by the medical staff and our professional staff here at the hospital. In its concept, I first thought that we would run into a problem between our professional staff here at the hospital and the MEDEX, but I've found that there has been no problem so far. Before the MEDEX program, we felt that we weren't giving our community the level of medical care that it should have, and this program helped alleviate that problem.
We had a construction worker who fell from a truck, striking his right cheek on a drum. He suffered obvious laceration of his cheek. However, the medics, on examining, was able to detect inequality in the pupil, the fact that the patient had altered vision. Accordingly, he consulted with me, and the patient was sent to Vancouver, Washington. This is a typical emergency that occurs in our practice that freed my time to continue with my usual rounds, to see the usual morning patients, and not spend time evaluating an injury that obviously could not be cared for here.
MEDEX Bevins has been here with us now for almost 2 years. It's made a great difference in our night work and our leisure time. Before MEDEX Bevins, we couldn't leave without other coverage around the area. Now, with him on duty, we feel free for golfing, fishing, and other activities which we would enjoy.
There is no question in my mind that the participation in this program has been of considerable benefit to me personally, as far as my feeling more free, with more free time, more time with my family, recreation. This may be only one phase of the benefit. I'm sure the community is now better covered than it was in the past.
What you have seen has been an approach by the medical profession to provide the leadership and direction in bringing about change that we feel is inevitable in our healthcare system. The MEDEX method of training and deploying appropriate health manpower can be adapted according to needs and resources into many geographic and socioeconomic settings. MEDEX is a program created by physicians, for physicians, to help them improve the quality of life for their patients. These are the faces of the newest health professionals in American medicine. They are part of a health manpower concept designed to increase the capacity of physicians to provide more and better care for their patients. They are one of the answers to the crisis in medical care.